Do you ever get that annoying itch that just won't quit? Even when there's no rash, no bug bite, and no obvious reason? Well, here's the truth. Itching might not just be a skin thing. In some cases, it's your body waving a red flag, warning you that something deeper could be wrong. Today we're breaking down 5 common itchy spots, and what your body might be trying to tell you. Some are surprising, and a few may even point to serious conditions like diabetes, nerve problems, or even liver disease. So don't scratch this video off your list. Let's get started. If you've been dealing with dry, flaky, or itchy skin on your lower legs, especially around the shins and calves, and there's no visible rash or irritation, it might be more than just dry skin. For many older adults, this kind of persistent itch can be an early clue that circulation isn't what it used to be. One of the most common culprits? Type 2 diabetes. When blood sugar levels remain elevated for long periods, they can begin to damage the small blood vessels responsible for healthy circulation, particularly in the lower limbs, where blood has to travel the farthest. This reduced flow means your skin gets less oxygen and moisture, making it more prone to dryness, sensitivity, and yes, itching. Beyond just being uncomfortable, this type of circulation issue can have serious consequences. When skin on your lower legs becomes thin, shiny, or discolored, it's not just a cosmetic change. It's a red flag that your tissue isn't getting the support it needs. Worse, reduced blood flow slows healing and increases the risk of infection. That means even small cuts or sores could turn into bigger health problems. If the itching comes with numbness, tingling, or a burning sensation in your feet, those could be early signs of neuropathy, nerve damage that often accompanies diabetes and poor circulation. If this sounds familiar, don't brush it off. Make a note of how often it happens and whether it's worse at night, when circulation naturally slows a bit. Bring it up with your doctor and ask about checking your blood sugar levels, especially if you've had borderline or elevated readings in the past. Catching these signs early can lead to lifestyle changes or treatment that protects your skin, your nerves, and your overall health down the road. If you've got a stubborn itch right between your shoulder blades that just won't quit, even though your skin looks perfectly fine, you're not imagining it. This could be a condition called notalgia paresthetica. It's more common than you might think, especially in older adults, and it's not about dry skin or allergies. This type of itch actually starts beneath the surface, in the nerves. Specifically, it happens when spinal nerves in the upper back get compressed or irritated, often due to normal aging, spinal degeneration, or poor posture over time. What makes notalgia paresthetica tricky is that the itch feels deep, like it's under the skin, and it usually sticks to the same small area, typically just off to one side of the spine. There's usually no rash at all, but if you've been scratching it for months or even years, you might notice the skin looks a little darker or leathery. That's from chronic irritation, not the cause. This condition doesn't respond to typical itch remedies because it's rooted in your nervous system, not the surface of your skin. Many people assume it's just a random itch, or maybe dry skin, especially since it's in a hard-to-reach spot. But scratching, while it may give a few seconds of relief, actually aggravates the nerve and makes the itching worse over time. Unfortunately, because it's not well known, notalgia paresthetica often goes undiagnosed. People live with it for years without realizing that it's tied to spinal health and nerve compression. There's no instant cure, but there are ways to manage the discomfort. Physical therapy can help relieve pressure on the nerves by improving your posture and strengthening the muscles around your spine. Some people find relief from topical numbing creams or even gentle massage and heat therapy. In more stubborn cases, a doctor might recommend treatments like transcutaneous electrical nerve stimulation, TENS, or prescription medications that calm irritated nerves. If this kind of itch has been bugging you for more than a few weeks, especially in the same spot, without a visible rash, it's worth getting checked out. Your doctor might order imaging to see what's happening in your spine or refer you to a specialist. Don't ignore it or settle for constant discomfort. Addressing the root cause can bring lasting relief and help you feel more comfortable in your body again. If your palms or the soles of your feet are constantly itchy, especially when you're trying to relax at night, it might be more than just dry skin. These areas are packed with nerve endings, which means they're often the first to signal when something's going wrong inside your body. And surprisingly, that relentless itch could be tied to deeper issues with your liver or kidneys. organs you wouldn't typically associate with skin symptoms. When the liver is under stress, whether from fatty liver disease, hepatitis, alcohol use, or even long-term medication use, it can start to malfunction. One of the early warning signs is a buildup of bile acids in your bloodstream. These acids circulate and irritate nerve endings under the skin, especially in sensitive areas like the hands and feet. Similarly, chronic kidney disease can lead to the accumulation of waste products in the blood, which can cause widespread itching, often on the hands, legs, and back, without any visible rash. The key clues? If your palms or soles itch without a clear cause, especially if the sensation worsens at night, that's worth paying attention to. Yellowing in your eyes, swelling in your legs, changes in urination, or persistent fatigue can further suggest something's off internally. Don't wait until symptoms pile up. A simple blood panel can check your liver and kidney function. Early action can help you protect these vital organs and keep your health on track. Sure, an itchy scalp might just be a case of stubborn dandruff. But if that itch is constant, intense, or comes with thick patches and flakes that don't go away with regular shampoos, there could be more going on. Scalp psoriasis is one possible cause, and it often hides in plain sight. This autoimmune condition causes the skin to regenerate too quickly, leading to buildup, inflammation, and persistent itching. But it's not the only culprit. Here's something most people don't realize. Chronic scalp itchiness can also be tied to your thyroid, specifically hypothyroidism. As we age, thyroid function naturally declines in some people, and when the body doesn't produce enough thyroid hormone, your skin can become dry, dull, and slow to renew. That sluggish skin turnover can leave your scalp feeling tight, flaky, and irritated, even if it looks mostly normal. Combine that with fatigue, sensitivity to cold, and weight gain, and you've got a strong case to consider a thyroid imbalance. If your scalp itch isn't improving, or if you're also noticing dry skin elsewhere, unexplained tiredness, or other subtle signs, it's worth digging deeper. A simple thyroid panel can give you clear answers, and early treatment can help you feel better fast. Don't chalk it up to aging or weather. Your body could be trying to tell you something important. Lastly, if you're noticing itching around your ankles or the tops of your feet, even when your skin looks clear, it might be a sign that your body is dealing with fluid retention or nerve issues. This is especially common in seniors who have conditions like diabetes, heart problems, or those who spend long periods inactive. When the lymphatic system struggles to drain excess fluid properly, swelling can build up, and that trapped fluid puts pressure on nerves and tissues, causing that persistent itch. Another possible cause is peripheral neuropathy, where damaged nerves send confusing or false signals to your brain, including sensations of itching, tingling, or even burning. This nerve damage often starts subtly, but can become more noticeable at night, disrupting your rest. Since these symptoms can signal underlying health concerns, it's important to pay attention rather than brush it off. Keep an eye out for swelling, tingling, numbness, or itching that gets worse as the day goes on, or when you're resting. These signs can point to issues that need early treatment to manage symptoms and prevent further nerve damage. If this sounds familiar, reach out to your doctor. Getting ahead of the problem can make a big difference in your comfort and quality of life. So next time you notice an itch that won't quit, especially in these 5 key areas, don't just grab lotion and hope for the best. Your skin might look okay, but your nerves, liver, or blood sugar could be sending important signals. Pay attention to when and where the itch appears. Watch for patterns like itching without any rash, and be sure to talk to your healthcare provider if it lingers or worsens. Because sometimes the real problem lies beneath the surface, and catching it early can make all the difference. If you found this video helpful, hit that like button so we know to keep making more like it. Got a friend or loved one dealing with mysterious itching? Share this video with them. It might give them the answers they've been looking for. And don't forget to subscribe and turn on notifications. We've got more science-backed tips to help you stay healthy, strong, and in control as you age. Thanks for watching, and here's to a calmer, itch-free day ahead.